Hepatitis is basically inflammation of the liver. It is the response of body to any injury. The body responds to injury by inflammation, that is edema formation. Now hepatitis is response of the liver to any injury to the liver. So the injury can be an infection or it can be a toxin which produces injury to the liver, and these produces hepatitis. We always have a doubt as to what is jaundice and what is hepatitis. Now jaundice is basically a yellowish coloration of the eyes secondary to increase in a content in the blood called bilirubin. Now this bilirubin is normally present in the blood and it increases when there is jaundice. Now when the bilirubin rises, it is called jaundice. Now jaundice can be because of problem in the liver. It can be because of problem outside the liver, like problem in the flow of bile from the liver to the intestine. So hepatitis is a condition where jaundice is produced because of problem in the liver. Now jaundice can be produced because of other causes also, which is not hepatitis. So when jaundice is produced because of liver problem, it is called hepatitis producing jaundice. Coming to the causes of hepatitis. Hepatitis, as I already told, can be because of an infection which affects the liver, or it can be because of some non-infectious causes. Now, infections which affect the liver are of different types. Now, they are named as hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. The non-infectious causes, the most important of which is alcohol. Now, alcohol is one of the most common cause of non-infectious cause of hepatitis. There are other rarer conditions like some medications or drugs which can affect the liver producing hepatitis, or there are some genetic causes also which can also produce hepatitis. But the most common cause in the non-infectious causes is alcohol, and amongst the infections there are a list of as I already mentioned, which can produce hepatitis. Coming to the symptoms of hepatitis. Now, amongst the infectious causes of hepatitis, the viral hepatitis, as I told, is the most common. Now, the viral hepatitis generally presents as fever, body aches, vomiting, some pain in the tummy or abdomen. These are the common symptoms that patients present with. Initially, they will not have jaundice. Once the fever and the body ache and the viral fever-like symptoms settle down, then they develop jaundice. Now, most patients recover from jaundice, but some patients do go into complications because of jaundice. Coming to the modes of transmission of hepatitis, the viral hepatitis are the ones which are transmitted. Now, we have 5 types of viral hepatitis which I already told you: hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Out of these, hepatitis A and hepatitis E are transmitted by feco-oral contamination, that is, by contamination of the food by feces from an infected patient. Now, this hepatitis A and hepatitis E contamination is quite common in developing countries, and epidemics of hepatitis A and hepatitis E is very well known because of feco-oral contamination. Coming to the other hepatitis, that is mainly the hepatitis B and hepatitis C, these two are transmitted by sexual contact or via blood transfusion or via injection drug abuse or from mother to child. Some rarer methods of transmission of hepatitis B and C are via tattooing or by sharing the razor blades for shaving. Now, coming to how serious is this problem of viral hepatitis. Now, as I already told you, we have infectious causes of which hepatitis A and E are transmitted from water, and hepatitis B and C are transmitted from blood transfusion or sexual contact or via injection drug abuse. Now, hepatitis B and C are a global health problem because hepatitis B and C, once they enter the body, do not go out of the body very easily, whereas hepatitis A and E are cleared from the body within 6 months. Hepatitis B and C generally are cleared from the blood, but then if it stays in the blood for more than 6 months, they are called chronic hepatitis and they are very difficult to clear from the blood. The global burden of hepatitis B is 400 million. So there are 400 million patients across the world who are having hepatitis B and they are carrying the hepatitis B virus in their blood for more than 6 months. Whereas hepatitis C, there are around 170 million people all over the world having hepatitis C. Now, most of the patients are found in the Asian continent and the African continent. The incidence is much less in the Western world. We don't have exact data as far as hepatitis A and E is concerned, but then the amount of hepatitis A and E in the Indian subcontinent as well as in the underdeveloped countries is huge. Now, how to evaluate for a case of hepatitis? When a patient suspects that he has got jaundice, he has to consult the physician immediately. There are right now simple investigations, blood investigations through which we can diagnose hepatitis. The liver function test is the first investigation that has to be done. In the liver function test, we can find out whether the patient has got jaundice because of hepatitis, and there are something called liver enzymes which are elevated in a case of hepatitis, which can also be found out by simple liver function test. Coming to the cause of hepatitis, if we are suspecting the viruses which I already told as the cause of hepatitis, there are blood investigations which can identify which type of virus is producing the hepatitis. Now, to find out if the virus has produced liver damage, we may have to do a scan, ultrasound scan of the abdomen to look for the condition of the liver. Coming to complications of viral hepatitis. Now, hepatitis A and E, which is usually transmitted by the fecal-oral route, is a self-limited disease. Most patients recover from the illness over a period of 1 month to 2 months. Only very few percentage of patients have severe form of hepatitis called fulminant hepatic failure, wherein the liver goes into acute failure and a few patients may succumb to the fulminant hepatic failure secondary to hepatitis A and hepatitis E. Generally, hepatitis A and E is a self-limiting disease, whereas hepatitis B and hepatitis C are a problem because they may stay in the body, as I already told you, and produce chronic hepatitis. The patients with hepatitis B and hepatitis C having chronic hepatitis over few years can go into liver damage producing cirrhosis or cancer of the liver in some percentage of patients called hepatocellular carcinoma. That is why hepatitis B and hepatitis C needs to be diagnosed as early as possible to see if it is producing liver injury, and they have to be treated at the earliest. So hepatitis B and hepatitis C are two viruses which has to be kept in mind. Coming to the treatment of viral hepatitis, as I already told you, hepatitis A and hepatitis E are self-limited diseases. All we need to do is give supportive care for these patients. We generally prescribe liver supportive medications which helps the liver recover fast when in case of viral hepatitis A and viral hepatitis E. Now, hepatitis B and hepatitis C are two infections which stay in the blood, as I already told you, and needs to be treated when we have evidence to say that these two viruses are producing liver injury. Now, hepatitis B has got some medications which brings down the virus in the blood and prevents the damage to the liver. As far as hepatitis C is concerned, there are some injections called interferons which are given once a week and for 6 months to 1 year based on what type of virus hepatitis C the patient is having, which also gets rid of the virus from the blood. Today we have good drugs for hepatitis B and hepatitis C, and so these two viruses, which used to be killer viruses previously, can be managed extremely well today with medications. How do we prevent hepatitis? Now, we have 5 types of viral hepatitis. Hepatitis A and hepatitis E, which are transmitted by fecal-oral contamination, can be easily prevented by ensuring adequate hygiene in preparation of food as well as storage of food, so that there is no fecal contamination of food, and by these simple measures viral hepatitis A and hepatitis E can be prevented. As far as hepatitis B and hepatitis C are concerned, as I have already told you, these are transmitted by blood transfusion, injection drug abuse, or from mother to child. Now these can be prevented by making sure that the blood transfusion practices are maintained everywhere. All the precautions are taken during blood transfusion. The blood is checked for these viruses, by making sure that the injections used are sterile, or by making sure that you take vaccination for hepatitis B. As far as hepatitis C is concerned, till today we do not have a vaccine, but when it comes to hepatitis B, we have good vaccines, and so hepatitis B is completely preventable. There are vaccines available for hepatitis A also. In India, we do not generally prescribe hepatitis A vaccines because most of us become immune unknowingly with the hepatitis A. Today, Indian Association of Pediatrics has added viral hepatitis A vaccine also in the immunization schedule, so that kids can be vaccinated against hepatitis A also. When it comes to hepatitis B, the vaccination is 3 injections which are given at 3 intervals, one today, one after a month, and the third one after 6 months. These 3 injections prevents hepatitis B 100% in patients. So viral hepatitis B can be completely prevented by vaccination. Now, what do we do if we find a pregnant woman with hepatitis B? Now, there is nothing to panic when you find hepatitis B in a pregnant woman. Now, we have to make sure that the hepatitis B doesn't get transmitted to the baby, and also we should make sure the pregnant woman is not in danger because of hepatitis B. What we have to do is we have to check the blood investigations to make sure that her liver function tests are normal. Second, we have to make sure that the hepatitis doesn't get transmitted to the child. So what we do is, at the time of delivery, we immunize the baby with hepatitis B vaccination. Also, we give immunoglobulins to the baby so that the virus doesn't transmit from the mother to the child. If the mother has got high virus in her blood, we have medicines to the mother itself, so that the chances of transmission of hepatitis B to the child is decreased. Amongst the non-infectious causes of hepatitis, alcoholic hepatitis is the most important. The amount of consumption of alcohol in many parts of India has risen dramatically, and this has caused a major burden of alcoholic liver disease in the population. Now, alcoholic liver disease can be anything from a fatty liver, which is harmless, to alcoholic hepatitis and cirrhosis, which can cause death in patients. Now, alcoholic hepatitis produces jaundice and can cause very high incidence of mortality in case it becomes severe. Alcoholic cirrhosis is an irreversible condition which can also cause death in patients. Now, to prevent alcoholic hepatitis, the treatment is simply stopping alcohol consumption. Liver supportive measures can be given, but the most important aspect is to stop alcohol consumption. I have given you a brief overview of hepatitis, both viral as well as non-viral hepatitis. I would like to conclude by saying that most of the hepatitis is treatable as well as curable. The patients have to take adequate precaution to diagnose it early, to consult physician whenever he has symptoms at the earliest, to take vaccination when it is required at the right time, as well as to take the medications when prescribed by the doctor in the right dose to prevent complications as well as to prevent progression of disease as far as hepatitis is concerned. Especially when it comes to hepatitis B and hepatitis C, early diagnosis makes a big difference. So diagnosis as well as diagnosing infections in the relatives as well as prevention of onset of new infections by vaccination will go a long way in treating hepatitis.